Okay, welcome everyone to the Population and Health Sciences Discovery Series session. Over the next hour, you'll hear from our program faculty, students, and staff. And our goal will be to focus on the experience within our online degree program, to explore what it's like to earn your degree, your MPH, in this field and online. I'll be moderating today. My name is Lisa Garber, and I use she, her pronouns. I'm the academic program manager for the Pop Health Online MPH degree program. And my role is to work very closely with students to make sure they have a great experience in the program, have access to all of the supportive university resources that they need, and to successfully meet degree requirements as you work towards graduation. I'd like to ask our other panelists to also introduce themselves at this time. Dr. Cardia, would you begin?
Sure. I'm Sharon Cardia. I'm the Senior Associate Dean of Education and a Professor of Epidemiology, and the Director of the online program.
Kim, would you go next?
Sure. Hi, everyone. I'm Kim Lucius. I'm the Assistant Director for the online programs in the School of Public Health. Welcome.
Thank you. Ethan?
Sure. My name's Ethan Boucher. I use he, him pronouns. I'm a first-year population health sciences student. Nice to meet you all.
Thank you. Mohammed?
Hi, I'm Mohammed. I'm a second year pop health and science student. I use he, him pronouns.
Thank you. Reed?
Hi, everyone. I'm Reed Richards. I use she, her pronouns, and I am a second year MPH student in the online population health sciences program.
Thanks. Chrissy?
Hi, I'm Chrissy Zamron. I am a marketing communication specialist here at the School of Public Health, and I work with the online program in the MPH.
Thanks, Chrissy. Chrissy will be helping us out in the chat box. So feel free to type your questions in. Why don't you all take a moment to type in a quick introduction for yourselves as well. Let us know where you're logging in from today, if you have access to that chat box there. So each of our panelists will be addressing the big questions that we expect for you to have right now. And we encourage you to keep using that chat box throughout the session to submit your specific questions that you have as we go. And we'll aim to answer all of the questions by the end of the hour today. But if we're unable to get to your questions, don't hesitate to follow up with us. Any of us can take an email via sph-inquiries@umich.edu and get back to you on your specific questions. So with that, Dr. Cardia, why don't you begin our discussion of population and health sciences by telling us a little bit about why a student would get a generalist degree and what is compelling about this specific discipline in public health?
Sure. So we decided to create this program because there are many ways in which public health and healthcare need to work together right now in order to better understand what is giving rise to sort of health disparities within populations. So I'm talking nations, states, counties, even sort of smaller communities. And why we decided to develop this program was that there were sort of these separate streams that were I'm going to say being built by each one of these disciplines. And we felt like we could bring, from a school of public health perspective, some of the tools for being able to see, where is the burden of disease in populations and what might be done within a community-based mindset as well as a healthcare mindset. This was also kind of one of the motivations for us to build it as a generalist degree, because those are fundamental things everybody needs. And we could also then allow students to take advantage of the depth that we have in the different disciplines. So we have 6 major departments within our school, and we built out elective series inside of each one. So you can get everything from the breadth of the population view, but then go into elective series in specific tracks. For instance, we have a track in analyzing health data from biostatistics. We have 2 epidemiology elective series that focus either on spatial epidemiology, so mapping disease in geographical contexts, or the advanced epidemiology methods. And we've got different elective series for all of these different areas: environmental health, health behavior, health education, health management and policy, and nutritional sciences. So we thought we could get the best of both worlds with the breadth and the depth if we did it this way.
Thank you. And next top question that we usually have at this stage is, what can I be with an MPH degree? What types of careers are we preparing for?
So a lot of people don't know that when we look at the whole public health workforce, only about 17%, I'll round it up to 20, maybe, have a degree in public health. And the vast majority of people are taking what was sort of a bachelor's degree in, let's say, environmental studies or in communications or in public policy, and then applying it to public health problems. So within the public health world, having an MPH degree really does allow you to most easily fit in where your, I'll call it, interest area is. So if you're interested in health communication or health education, this kind of degree easily can help you to sort of see, oh, these are the fundamentals, these are the practice pieces, and now I could go and work within a unit that needs those skill sets. We also know that people can take these skills and go work within, let's say, a hospital in their population health space, because nonprofit hospitals have to do community health needs assessments and be able to really look at what is the role of the hospital inside of the community. So we've had some of our graduates do that kind of work. Other types of jobs that you can do often go with analyzing data or being able to know how to bring data into a problem. We also have had people that work with community organizations and are doing work that needs, for instance, somebody to develop surveys, analyze data, and help that nonprofit move, forward in its health equity goals. So those are kinds of things that we've seen our own graduates do. And of course, there's always a few that go on and do other degrees. We've had a couple of students that have moved on to the PhD level from this program. So there's a lot of different options that are out there.
Did we miss anything? I'll just quickly pull in our panelists, our student ambassadors. Are there any career ambitions that you all have for this program, for next steps that we missed in there? Fully covered. Wonderful.
Well, I didn't really talk a lot about how some people are using their MPH to move up in their organization, because the master's degree does recognize that you've got a level of, I'll call it, skill that a lot of different organizations are looking for that promotion for people. So you can branch out or you can go higher.
Good addition. Thanks, Sharon. So let's talk a little bit about the design of the program. How is the program designed to be accessible and flexible? What do faculty expect of students in this program? What's the course schedule like? So
we are committed to having a program that's 100% online. It doesn't mean that it's 100% asynchronous. And I want to make that distinction, because there are some MPH programs where completely asynchronous, you're doing everything on your own. And, for lots of ways, that's just not the Michigan way. The Michigan way is actually about bringing people together, getting connections, forming networks, in a sense, building teams of people that can work together, because we realize public health is so complicated and needs that kind of networking as a general, kind of way of making progress. So we've invested in having materials that are sort of well organized in a weekly to do. There are videos and readings and assignments, as well as live Zoom sessions where you'll meet with the faculty. Typically, you'll work through sort of problem areas. There'll be time for office hours, questions and answers. Getting to know some of the faculty is one of the nice perks for the students, but it also opens the window for the faculty to get to know you as students. There's a kind of a secret benefit that faculty don't often talk about of being able to work with working professionals, where you are actually bringing in to us information about what is useful, what is needed, and how we can sort of build a curriculum that's more responsive to the world's needs. And that's one of the big, I'll call it, heart drivers of the faculty that teach, is how can we be useful to the world? Maybe one other thing that I would say is the workload. Going forward, we had one sort of style of scheduling that really was pushing students to sort of download, be able to metabolize it, and kind of do well on assignments, that we felt like was a little too aggressive. So we've stretched out the courses now to be uniformly 8 weeks, and typically you'll have 2 courses at a time with a little bit of a break, or at least not new material coming in that 8th week. So we can get a little bit more of an attention to, call it an equilibrium cadence that you can sustain for 2 years. It still amounts to probably something like 15, sometimes 20 hours a week. But we try to sort of work with each other so that it's not all mounding up, and it actually, can be done. And I think that many of the students that we've worked with have given us good feedback about, how do we do this in a way that doesn't actually bury people, but still actually is quite challenging and enjoyable. So I'm sure I'll hear some feedback afterwards, but this is the University of Michigan, for top school of public health, and we really want our graduates to be the best in the world. So we're going to push you as you push us. So.
Fantastic, Sharon. I think that's a really great segue into hearing what it's really like to be in the program. And that's where our student ambassadors come in at this point in time. So let's turn attention there. I've got some priming questions, but I'd like to invite all of our attendees to really utilize that chat box and type in questions that you have for our panelists as well. But Reed, why don't you start us off? Can you tell us a little bit about why you chose this program originally and how it's working out for you now that you're in year 2?
Absolutely. So I am currently a working professional in public health. I have been with my agency for 8 years now, and I knew that I needed an MPH so that, like Sharon mentioned earlier, I will be able to continue advancing in my current organization, because I work alongside some of the best scientists and researchers in the world. And a bachelor's degree was not going to help me keep up with them. So for me, looking at different MPH programs, I knew that I wanted something that was going to be online, because with my work schedule, I wanted the flexibility to be in charge of my own timing of when I could complete assignments, and going back and forth to a campus was not going to cut it for me. I didn't have the time to waste to be in the car going back and forth, or taking night classes only when I have work 9 to 5, Monday through Friday. So the program flexibility was a huge piece for me. I also really like the way that the program is designed and organized. So what Sharon just talked about with the way that the class schedule is kind of these shorter compressed classes, but you have fewer classes at a time. My rationale was, if I have 15 things going on at work, I don't really want to be also thinking about the fact that I'm taking 4 classes at the same time, and each of those classes have 5 or 6 things that I'm having to manage. That's too many things happening at the same time. I can multitask with the best of them, but not at that level while working full time. So I knew that the Michigan program design was really key. 2 other factors I want to mention that I cannot underscore enough. The program faculty and administrators of this program and the staff that support this program are far and away top-notch, just absolutely beyond incredible. That was a differentiator for me when I was going through even the application and admissions process. I'm pretty sure I met with Lisa individually multiple times. She probably knew who I was before I matriculated into the program. And the same kind of attention to you as an individual that you see throughout the admissions process is what you get when you're in the program. And that was so valuable to me, because I didn't want to attend a school that kind of had the mindset of, it's your honor to be in our program, which did happen at one of the schools that I was speaking with. Instead, it was, we want to help you find your best fit. This is what our program offers. How can we support you in reaching your goals? We're so happy to have you here. And the faculty and administrators and everyone in this program, from admissions all the way to currently in classes working on graduation required projects, or APEX and ILE, that support has flowed. The last thing that I'll mention is network, which Sharon has mentioned as well, that I knew that I wanted a school that was going to have a strong alumni community. And that meant that I needed to have strong people beside me in my cohorts as I was taking classes. So I have found that the community that Michigan has is not competitive. It really is, as cliche as this sounds, uplifting. You're going to find the people who will work with you in your classes, who will become peer colleagues for you as you go out into the world and join an alumni network of 17,000 School of Public Health graduates from University of Michigan. I have community in this program now, and I will be joining an alumni community upon graduation that cannot be matched. Those were my main reasons. And I'd say in year 2, it's going swimmingly. This program is my best fit program, and I would encourage all of you to find your best fit as well.
Thanks, Reed. I think that's a really key point to say, we want you to find your best fit. And that's how Michigan Public Health approaches things as well. So we'll do what we can to make sure that y'all find your right fit. Ethan, I have another question, and I'll direct it to you for now. You're in week 9 of the program as a first-year student. Can you tell us what you have going on this week?
Sure, I'd love to. So like Lisa said, I'm in week 9. So we just switched from the first half semester courses to the second half semester. So earlier this week, I finished up my Principles of Epidemiology for Public Health course, as well as the Social Determinants of Health course. I ended up enjoying both of them a lot more than I thought I was. I mean, I knew I was going to love public health, but I didn't know I was going to enjoy epidemiology as much as I did. But the Social Determinants of Health course was also really interesting. We spent the duration of the course designing and proposing an intervention to target a health disparity. I thought that was really interesting and a lot different from projects that I undertook during my undergrad degree. Instead of just doing research for the sake of research and presenting that, you researched a topic, you actually had to think critically about how we could address this problem and propose an intervention. So that was really interesting, and I enjoyed doing that a lot. So starting this week, I'm taking Introduction to Biostatistics and Nutrition and Public Health. I actually have my first live session for my nutrition course right after this, so I might have to dip out a minute early. I apologize to you all. As for time management during the week, for me at least, the first half of the week up until about Wednesday, I focus on finishing my readings as well as the videos for classes. At least for me in Japan, my live sessions are Thursday and Friday morning. So I try to do all the prerequisite material before then. And then after the live sessions, I start to focus on the assignments for the week or any projects. And I repeat that every week. And like Dr. Cardia said, it is about 15 to 20 hours a week, but it's definitely a manageable amount.
Awesome, thank you. Mohammed, how and when do you connect with the Pop Health community? So with your peers, those who are here and others in the cohort, as well as your faculty instructors?
I'll start off by talking about how we've been connecting with peers because for some reason, for our cohort, it's been quite organic. And from the first class, people were like, oh, who wants to form study groups? And then suddenly people started sending Zoom links and stuff like that. I guess everyone's really, nervous about the content and the assignments and stuff. So that kind of pushed us a little bit, but it was kind of interesting because all of us sort of gave our own expertise. I'm not a STEM person myself, so like science scares me a little bit, but lots of people that like they're physicians and stuff like that in our program were really, really helpful about their own knowledge. And of course, they rely on us non-STEM people a little bit when we're talking about sociological factors that affect health. I think we also did just a catch-up session, no homework, no study-related chat, and I think Reed was primarily leading that at that point of time, and we would just chat about our hobbies, stuff like that. It was quite fun. With faculty, I think the faculty were really, really helpful. They have been really helpful thus far. In most of our classes, the faculty would actually reach out to us multiple times to ask if there are issues, and they're quite responsive as well for most of the classes on Slack, email, what have you. And I think some of the professors, although I'm not sure how they have been doing this, but I would be sending them a Slack chat at like 2 p.m. here, which is 2 a.m. Eastern Standard Time, and they replied. And then they were like, oh, do you want a one-to-one session? And I'm like, okay, this professor is awake at 2 a.m., but okay, sure. Thank you so much for helping me. Yeah, so I think as the program goes on, as the classes get smaller, when you go into the respective what do you call it? Like I forgot.
The electives.
Yeah, the electives. Yes. So when you go into the electives, EPI and nutrition and health behavior, health education, the classes get smaller and the professors get to know you better. So don't worry too much because the first class is going to be huge and the professor's not going to remember all of your names. But as the program moves along, you're going to get to know a lot and lots of the professors better. Yeah, that's all.
Awesome, thank you. I'll just take a quick pause to see if anybody wants to chime in on each other's responses or if we have questions from the chat we want to address before I carry on.
I want to add to what Mohammed was just saying that I wouldn't say your classes are huge in the beginning. I think we had 70-ish people in our starting classes, which is probably comparable to some folks for their undergrad courses. Those were bigger than my undergrad program, but I went to a very small liberal arts school. But I think even within, the larger class sizes that you start off with, kind of those intro classes, and once you get into the elective series, you'll tend to find that you find your people. So just what Mohammed was talking about with forming study groups and making connections with folks who have different skill sets, that's really one of the assets of this program, is that because it's primarily designed and targeted for working professionals, you're going to find folks who have different real world skills and experience that they can bring to the conversations that you're having to enrich the discussions in class and outside of class. And so you'll find that when you're connecting on projects or you're working in your study groups, that you find the people that you kind of connect with who seem to be working at the same pace and level that you are, or just happen to be in the same time zone. And so it's easy for y'all to connect because your schedules sync up. That happens too. That's great. You'll tend to find those people who become the support system for you as you go through this program. And I want to reiterate what Mohammed said too, that the professors are extremely responsive. They will find you and send messages on Slack. They respond on email. They hold office hours. Sometimes they hold extra office hours if they know that there's a difficult concept or something that students are struggling with, really just to make sure that people have options for the support that they might need. And it really becomes up to you as a student to take advantage of those options and to make sure that you're organized and you're staying on top of those opportunities, because that's what's really going to enrich the program for you and make it a worthwhile experience, right? If you're tapping into those things, because those opportunities definitely exist.
Awesome, thank you. We have a question in the chat box that I'd like to address. Portion one, I'll route to you, Sharon, and then portion two, I'll ask to our students. Let's start with talking about some of the certificate options. So Sharon, I'll have you talk a little bit about the how the certificates work, if there are limitations in the certificates you can pursue after you finish the core, and then I'll ask all of our students to talk a little bit about the certificates you hope to do or the electives that you hope to do.
Yeah, so I can talk a little bit about the nuts and bolts of the certificates. So we have a standard of a minimum of 11 credits in order for a program to be able to give a certificate. So when we developed the certificates for the online program, we developed them to be exactly 11 credits, and that they would sort of follow in a series. Now, what has happened over time is that students are learning that, I have interest areas that are across these elective series, so maybe I'll do one certificate, so a series, and then I'll go into my, let's say, last semester or so, and I'll mix and match. You can mix and match different courses. You just have to work with Lisa and I or another advisor to make sure that you don't like stumble into a very advanced mathematical class without having enough of the background. So those are the only ones that we've seen people just be like, oh my gosh, I really am interested in this course. Can I take it? And the answer might be yes, if you have a background in statistical methods or R programming or something like that. And it might be no if you've never done anything like that. So work with us and we'll help you navigate. So those are the only real limitations. Maybe one other thing I would say that is sometimes hard to choose. There are multiple elective series or certificates being offered, and you might want multiple ones, but we try to temper that by saying if you come into the program, we'll give you audit access to another elective series. If you're not taking it for credit, you can still see what's in there, because it really is wise to just do one elective series, one certificate at a time. We don't want to, we don't want to sink anybody's boat trying to do too much.
Thanks, Sharon. Any of our students want to weigh in on which electives that they're choosing?
I'll go. So I am taking health behavior and health education courses right now. So that's what I've been doing in my Series 1 courses. I'm not obligated to apply for the certificate, but I may end up applying for the certificate just to show that I've had that specialization in, I think it's health equity is our Series 1 for health behavior and health education. But in my second series, there is absolutely a class I am taking in the health management and policy series that is dissemination and implementation science focused. I am so interested in that. So I will be mixing and matching with that health management and policy course as my first course in my series 2, and then switching back over probably into health behavior and health education. And the reason that I'm focusing on these courses is because my interests in public health and where I see myself going in my career are really focused on communications and partnerships activities. And while I really struggled with, I could use this as an opportunity when I'm in school to learn something about a subject area that I don't have as much expertise in, like epidemiology, or something that I've always had a passion in, like nutrition. I kind of wanted to focus on, well, what am I doing now and where do I want to see myself going? And so prioritizing those courses that were in the series that make the most sense for me, for current and future goals was really the way that I approached the electives. And everyone has a different approach. Some people want to make themselves as marketable as possible for jobs. So they're like, I'm going to do hard science and get all my epi classes, or I have to do data analysis at work. I have to have biostatistics. It is key, or I'm not going to be able to go anywhere, in my job. So it just really depends on kind of what the priority is for you and the way that you approach your elective series. That's just how I've been doing mine in HBHE.
Awesome, thank you. I'll say one of the other things about choosing the electives and the certificates is that the core classes really set you up for making a wise choice, right? So, Ethan, you're in week 9. It might be too early for you to choose which electives you're going into because you haven't taken an introductory course in every subject area yet. That's what your first year is designed to do. So by the time you're done with the core, then you'll really have a good idea of what each area entails. You'll have faculty contacts and advisors in each area that can help you make that choice and either decide to go really hard in one area or kind of mix and match the way that Reed is describing.
Yeah, I couldn't agree more. I guess when I came into the program, I was really interested in going into health behavior and health education, but after taking that one epidemiology course, I'm really interested in that now and starting to rethink. So I'm glad I get to get a little taste of everything, especially for me, because I don't come from a public health background. My undergrad was in anthropology, so it's really great that I kind of get to see everything before I start making commitments.
And that's unique about this program compared to some other MPH programs that want you to kind of declare a concentration as you apply. It's nice that you have that option to learn more about what you might not know about yet, what the options could be.
Thanks, everyone. Oh, Mohammed, do you want to weigh in on electives?
Yeah. I mean, since the first epi class that we took with Dr. O'Neill, I already wanted to do epi at that point of time, but it was nice to be able to try everything. Nutrition was not my cup of tea. It still isn't, but it was very enjoyable because the instructors were great. And I was like, okay, this is an introduction to this field, which I can use somewhat in the future if I need to. So it's always helpful like that. I've been doing the epi electives, and they're really fun. And because I am still a practicing social worker, and it applies so much to my job in a hospital. And I really want to do, because when I took social epi, I'm like, this is what I want to do in the future. Yeah, I'm gonna go with epi all the way till graduation.
Wonderful. Thanks, everyone. Let's switch gears here and talk a little bit about some of the other components of the University of Michigan that you all have access to. So I'll ask each of you to just talk a little bit about what university resources do you find helpful as you go through this program. First person to unmute can start.
Can I just say, number 1, Lisa Garber, number 1, Sharon Cardia. Like 1A, 1B are Lisa and Sharon. I'm not kidding when I say that the difference makers when you are picking a program with the administration and the faculty who support the program, I cannot underscore enough. When we have had challenges or issues that have come up, I know that I can go to Lisa and say, this is what we're experiencing. This is what I'm experiencing. I need help. I need support. And she has the perspective of, okay, I hear what you're saying as a student. What can I marry with what I know on kind of the administration side? Or I can go to Dr. Cardia and say, this is an issue that has come up, and it might be in the way the program is designed. And because Dr. Cardia is a dean in the School of Public Health who happens to be over this program and, is designed it to be amazing, she can kind of take the needs of the program forward to the rest of the School of Public Health. These two individuals are fundamentally making this program thrive from the student side and I'm sure there are more people that I don't interact with who plug into that. But I know that those two are a significant reason for why my experience in this program has been as positive as it is. Other resources, I mostly am tapping into my peers and my fellow or my professors. As far as wellness and other academic pieces, I haven't tapped into those yet. I'm involved in student organizations though, so I'll put a plug in for that. I'm an official admissions ambassador for the School of Public Health, and I'm also involved in our student government, which is the Public Health Student Assembly. So I'm one of the 2 online program members in the broader School of Public Health student government who I'm advocating on behalf of our online program all the time. And we've got something in the works, maybe for, some social activities with online and residential students that we're trying to kind of bring to fruition. So really trying to build community and make sure that our online program is the best that it can be.
Thanks, Reed. That was a great overview. Ethan Mohammed, did we miss anything?
I'm still pretty new to the program, so I haven't had the biggest opportunity yet, but I have reached out to the career services department, and they have been just incredibly helpful. As I said before, I don't come from a public health background, and professionally, I've been working in education for the past 7 years. So all of this is still very new to me, and I'm trying to figure out exactly where I want to go, career directions. And, I think first week of the program, I set up a 45-minute meeting with the career services department for career exploration. And the amount of resources and information that they had just ready, just blew me away. And as everyone's been saying, there's just such a huge alumni network, and just for finding jobs and all the services and utilities that they provide. It's been really comforting for me as a first-year student that, okay, when I finish this degree, I'm going to be able to find a career and get started in public health.
Yeah, I think just echoing Reed, Lisa, and Professor Cardia have been really helpful, but also shout out to Chrissy because she's an amazing marketing person for the program. If you like some exposure to writing for the school blog and stuff, she reached out to me personally, but I think you can reach out to her as well while you're in the program to experiment writing about some health issue that you're passionate about, especially if you have your own background or career that have some intersections with health and you'd like to, talk about it and bring out in the open in terms of the public health community, you can reach out to her. I think on top of that, I also participated, because as a Michigan and public health student, you're also receiving all the emails from different student organizations. If there's anything online, you can just pop in lots and lots of discussion sessions for different topics, lectures that are just open to all students. And I've really been enjoying them. Yeah, I participated in the health policy case competition as well, and it was completely online. Hoping that this year will be the same, so a lot of the online students can participate as well. And it was really fun. It's quite a good exposure into health policy in Michigan specifically as well.
Wonderful. Thank you all. Great choices. I think that's a good time to shift gears here. We have a question in the chat box about putting together a strong application and talking about, you know, when you don't have a science background, you maybe don't already work in public health, how do we approach an application? So let's just shift gears to that side of things and talk a little bit about how you can tell the admissions committee that you're a good fit for this program. Hopefully we're helping you decide whether you are, you know, a fit for this program. Now we'll talk about how you can tell us that. So I'll probably turn to our admissions committee members here. Sharon and Kim both sit on our admissions committee. Kim's our admissions chair and Sharon's our program director. So they really have firsthand insight into this process. Sharon, you want to start a little bit and talk about what type of student is really successful in this program, what we see in a common application?
So, I mean, I think that students that have an interest in some part of, I'll call it the disciplinary background of public health. So that is either the social sciences or the physical sciences, an interest in health and, for instance, research on health. But it is pretty broad after that. And, you know, I like this slide because it kind of gives a window of the kind of person who, you know, is attracted to this can be, you know, many different types. So we have had some people that have just transitioned from their undergraduate into this program, and that is our less likely because we really do put an emphasis on having this be a program where working professionals can come together. But there have been occasions where that sort of rare undergraduate is just knocking it out of the park, knows what they want to do, already has got internships. I mean, they really are almost operating as somebody in the field. And so we wouldn't exclude them from it, but we need everybody to have a bachelor's degree, have some, I'm going to say, leg into the public health field. But we've had some of the best conversations, I'm going to say, across the generations. So where we've got like a seasoned physician or nurse who is actually like inside of healthcare, trying to wrap their minds around the population side of things. And then some newer person who understands the population side, but not the healthcare. And that dialogue is what makes this sort of one of the, I'll call it, hopping places to be on a Wednesday at 7 p.m. after work. We also are very lucky to have people from the military who are thinking about the health of the people within their services, everything from vaccination to you know, diet or other kind of community health needs. And this also is another sort of perfect perspective to come in with. So I don't want to say there's like one way to do this. There's hundreds of different constellations of people that this program fits for.
Awesome. So Kim, would you mind taking just a minute to talk about kind of the components of the applicant criteria that we're looking for?
Sure. So what we're looking for in an applicant is we're looking for someone who's got the ability to be successful academically. So we're looking for applicants with good grades. Some of the courses in the program require strong math skills. So we're looking for applicants who have experience dealing with, quantitative analysis. We look at math and science courses taken in college, but we also look at quantitative experience gained through work or research. Some of the applicants we've noticed have actually enrolled in math courses prior to applying in order to enhance their quantitative skills and prepare themselves for an MPH program. We're looking for applicants with experience in public health or experience related to public health. This is typically through professional work experience, but can also be through volunteer experience. We want to make sure that you know what you're signing up for. So we look for applicants who have an understanding of public health, who are passionate about the field, and you can demonstrate this in your statement of purpose. It's always helpful when applicants share their stories and they tell us what lit the spark and what motivated them to get into public health. And we also want to know, why are you applying to the University of Michigan? What is it about our university that excites you? And why online and not a residential program? So those are some of the things that we're looking for in an applicant.
I just want to echo what Kim said about people's experience, because we are not just looking for you to have work experience. We're really looking for what is, I'll call it the wide range. So it could be volunteer experience, it could be experiences within college, it could be even ways in which you've worked with other organizations like the United Way, the Red Cross, anything like that, that is an indication of, why public health? This is not a field for, in a sense, the faint of heart, because it's not dealing with small problems. It's dealing with the big problems of the world. And so having people who are interested in being of service, not just on a whim, but because, I really have already gotten my feet into this a little bit and know that there's something in here for me if I do get the skills and the knowledge to be helpful. So just echoing a little bit more of what Kim was saying. Thank you.
Lisa, I don't want to put Ethan on the spot, but Ethan, because he's new in the program, that was the first year I was on the admissions committee. And I remember Ethan's application. And I would say Ethan is not a typical, like, we didn't read his application and say, oh yes, he's working, in public health, he's a perfect fit. But Ethan has a very interesting background, as you mentioned, working in education, but I remember he connected education to public health. And I thought, okay, well, he gets it, and he knows, what public health is and has some direction. So Ethan, I don't know if you want to add on to that, but to me, you're an example of someone who doesn't really fit the mold, but applied anyway and got admitted.
Sure, I can talk a little bit about my experience if you don't mind. So yeah, from an education background, I've been working actually as an English as a foreign language teacher in junior high schools in Japan for the past 7 years. So no, I don't come from a public health background, but working in schools in Japan, I got to see how health is taught and thought of in a different culture all these years. And it really got me thinking about, what could we do differently in America to teach health better, teach nutrition better within schools, and how could that impact health in the future? I had an interest in public health in my undergraduate. I was an undergrad anthropology major. I took some medical anthropology courses and the like, but I wasn't really in public health. So having that work experience and that little bit of background really helped me connect myself to public health and really articulate why public health and what I want to do with it and where I want to go. And I think that's really important to do in your application.
Definitely.
Agreed. I think that's a really strong tip for everybody here who's thinking about, how do I put an application together given any amount of background? Having a clear vision and understanding where you're going and being able to draw connections of your experiences to where you're headed. Great tip. I'll switch gears for just one quick moment here. We do have, all of the checklist items of what you need for your application. So if there are any other quick tips that y'all have for putting together any of these pieces of the application by the priority deadline, by the final deadline, this would be a great time.
I would say for those letters of recommendation, make sure that you check in with the folks that you are hoping to receive the letters from and kind of let them know that you're going to be making this request. It's nice for them to be prepared so that they can start thinking about what they're going to include in the recommendation letter. And they have a little bit of time to kind of organize that, because sending it through the SOPUS portal is, you want to make sure that they're comfortable with that. And depending on who it is, they might not be the best with technology. I know my mentor that I asked for a recommendation letter, she's like, I don't know about this portal. I guess I did it, but let me know if it didn't go through, and ended up being fine. Clearly I'm here, but just make sure that you prep them. They always appreciate that heads up, and it's helpful to, to have that, because that again speaks to the kind of, having that breadth of experience that you bring with you and how you'll bring that into the program. Those letters of recommendation can really help to demonstrate that, I think. So giving your recommenders a good heads up is always helpful.
Yeah,
We
I'm
have.
not sure if this. I'm
Go ahead,
sorry.
Mohammed. No, go ahead.
Yeah, I'm not sure if this is gonna help, but I'm not sure for Ethan, but I thought back to my undergrad years and it's like, maybe I should ask for my sociology of health professor to write me a letter, since I knew her well, and it is the class that has the most connection to public health. Yeah, and I did that for most of all three of my letters of recommendation. So and one of them even like asked me to, how do you want me to write this, from which angle? And that's always helpful, because I think you know yourself the best, and you also know what you want out of this program. And the person you're asking the letter of recommendation from might not know that, even though they knew you as a student. So it's really helpful to have that kind of two-way communication with them as well.
I was just going to say that that's very important, Mohammed, because I can't tell you how many letters we've gotten where it says so-and-so is applying to the University of North Carolina, and we want you to admit this person. Well, no, this is not the University of North Carolina. So make sure your recommender knows which institution you're applying to.
The other thing I'll add for folks to consider, I know there are some people who are like, oh, I don't have the quantitative experience, or I haven't been working in public health. The cool thing about public health is that there's room for everyone. It truly takes all types in this field. And I can say this working, over the last 8 years. I don't have a storied career yet, but hopefully someday. But in the 8 years of experience that I've had working in public health already, you need the people who are great with math, and you need the people who are great with words. And so bringing those experiences that you have across different fields and different industries and volunteer experiences, anything that you're bringing with you, again, to Kim's point, make the connection for why public health is going to help you get to your final destination. But don't be worried about where you're starting from, because we need all of you in public health, truly. to have the kind of impact that we're hoping to have across these populations, everybody needs to pitch in. And so we're happy to have you just apply.
Yeah, and just to echo Reed a little bit, I feel like the quantitative part at the beginning as well, even it was so intimidating because they were like, oh, what is sensitivity and specificity? And then a lot of people were confused. And the professor did a good job explaining it, but it was really helpful because we had people from all kinds of backgrounds and they were better with words. So they explained it in a way that was easier to understand, your peers, I mean. And it helped a lot of people to be able to understand better. So I thought that was really, really helpful. So do not worry too much if you think that, oh, I'm not too good in stats. Just try your best to dig up experiences with quantitative research in your statement. But otherwise, if you feel that you wouldn't be able to excel in statistics in this program, think otherwise, because there'll be lots of people to help you with that.
Thank you for all of those perspectives. I recognize we have just 2 minutes left and Ethan has to hop off and go to class.
I was about to say, I need to hop over. I'm sorry,
Thank you
everybody.
so much for joining us.
Thank
I'm
you.
looking through just final chat messages to make sure that we get everything answered, but I want to give special consideration to everyone's time if you have to hop off. I see one question in here, Chrissy, thank you for addressing it specifically about financial considerations and the way we handle our scholarships. Definitely get your app in by the priority deadline in February if you would like to be considered for our school scholarships that are about 25% of tuition. And look for lots of different funding sources. Reed, Mohammed, any suggestions on searching for funding?
One benefit of this program compared to other programs, you are considered a full-time student. Many graduate programs that I was looking at, considering I was going to be a working professional, I was going to be considered a part-time student with the number of credit hours that I was taking, which made me ineligible for graduate scholarships. So that is a huge benefit of this program, that even though you're taking select courses at a time, over the course of a semester, you're still getting 4 courses. So you are a full-time student, and that makes you eligible for scholarships that you might not ordinarily be eligible for with other programs where you might be a part-time student. So that is a huge, huge advantage of this program when you're looking for external scholarships.
Good call out. Thank you very much. Qualifying for student health insurance. A good question, Francesca. You can purchase a domestic student health insurance plan through the University of Michigan. It's a really great rate. You can find it on the website for the University Health Services. They offer the domestic health services plan. A lot of our students find that it's a cheaper option than what they're doing through their employers and switch for the time that they're enrolled. But it's a small additional fee to participate in that, because so many of our students maintain their health insurance while they're working full-time, through their employer. We didn't want to fold that into tuition, so we separated it out and let it be opt-in. Thank you all so much for your time today. Thank you to our panelists. Thank you to all of our prospective students who joined us. Please reach out to us if you have any further questions. If you send an email to sph-inquiries@umich.edu, you can reach any of us. Just pop our names in the email, or say I have a general question, and one of us will get back to you and make sure that you have all of the information you need to make informed decisions as you move through the application process. Chrissy put in there dates for our admissions coaching sessions. If you start an application and want to meet with Kim Lucius and talk about your application and get coaching moments on that, you can join us on December 7 and 8 to talk about your specific application, which will be in plenty of time for the priority deadline. Thank you all so much. Have a great evening.